this goes back to 1997, 1998. And some of the people listening, right? Some of the younger PTs are going to go like, I don't know what the hell you're talking about. But there was an app called Napster. And Napster, all it was a file sharing service. They were just the first, there were not apps to share large files. And in terms of files, they focused on music. They focused on MP3s. And they were the first ones to say, you come here, you get these songs for, it's insane to sit here right now in 2024, and when this was not that long ago, to think like the barrier to get music delivered to you was the radio, where you just sat there passively, or you could actively go spend lots and lots of money on a disc. But even then it was not really portable to bring your whole CD collection. And they didn't build the internet, but they were able to build a business on the internet. Although famously, Justin Timberlake's character in The Social Network was like, it's not much of a business in free music. But the situation I want to talk about was really like one band who should have been the face of anarchy and sticking it to the machine. Karen has no idea about Napster. They were just a file sharing service. So you went on this app, opened it, searched a file, you said Foo Fighters Everlong, and now you could download it from someone else's computer and it would be on yours. Everybody's like, well, that's what Spotify is. I'm like, right, but before Spotify, there was no barrier. And now the solution's so obvious. But Metallica, who should have been the band, the face of anarchy and stick it to the man, was the band doing press conferences saying, you have to outlaw this. This is going to kill music. Starving artists. We're millionaires. We're not doing this.
Yeah.
We're doing it for the bands that are out there now who aren't going to make it. And I thought it was cool because he's also one of my favorite, band leaders, which was Dave Grohl. And he was like, number one, a solution will find, you can't legislate against technology. You could try, but it's like shoveling against the tide. It's going to find its level. It's like water. It's just going to find its level. So you can say, we're going to pledge to never let the PT out of this, all those things, but be the better solution. And Dave Grohl was saying, even if we give your music away, let anybody download it, it's what can you do as the Foo Fighters or the band that hasn't broken next that technology can't. He's like, give the music away for free. Listen to it on your phone all you want. Make your money on the live shows and the experience and the relationship you build with people who listen to your music. That's what's going to support you. I forget who said it, but the whole idea of 1,000 true fans. If you get 1,000 true fans to
Kevin Kelly
give you $1,000 a year. If you provided $5,000 in value and asked for $1,000, you're net positive and people will have the relationship. So he said that. But now like the solution is somewhere in the middle, because for Napster or Apple Music, I happily pay $10 a month and I have access to every song in the world. Now, I don't know how it is, and every couple of years the debate comes up, is it worth it for the artists? Are the artists getting enough? That sort of thing. And that they should get enough, right? We're sort of like democratizing the experience. But I think the solution will be somewhere in the middle. It will not be the apps that we just talked about in the way that they exist now. It will not be just PT either. It will not just be PT how it is now. It will not. I'm very sorry. Don't be Metallica. Don't try to be Metallica, right? The answer is going to be somewhere in the middle. Those who lean in my opinion, and say, let's try this. What do I bring to the table? Those are going to be, in my opinion, the people who come out on top and have the best time and deliver the best care.
I mean, it's likely that without Napster, we never would have had the access to music that we have today.
Yeah,
they forced the hand of all the gatekeepers to figure out how can we get music out cheaper, how can we get music more accessible. And I would argue that while yes, it probably brings down net profitability for the content producer, you still have somebody like what's the girl's name? Oh my gosh, every girl. Who?
Taylor Swift, you mean? When she
Taylor Swift. She's making hundreds of millions of dollars. You still have the success because of the exchange in value. Of course, they've built community. There's the whole Swifties movement. But what's interesting in this, and I'm curious to hear your thought on this, why is there not a Napster for research? So my understanding, and I think you've said it before, clinical research. If you reach out to the author is allowed to give you the clinical research for free. Is that correct, or am I wrong?
Yeah, yeah. I mean, I think there's always like, some stipulations, but typically from what and this was like one of those aha moments where when someone told me like, this can't be true, and people were like, it's actually true. But if you reach out to an author who produced a piece of clinical work, they're allowed to give you some, and there might be a limitation on they can send out 50 copies.
Sure.
I was actually just reading something about, I believe the publisher was Elsevier, and how they can embed and figure out, like, if you somehow went to Sci-Hub, which is a website no one should go to because you'd get free research, right? You should never go there. It's bad. But if you get a PDF and then I send it to you and you send it to someone else, even though it's a PDF, there's metadata on there. They can track those things. Like,
wow,
they're so sophisticated because they're gatekeepers. And yeah, clinical research is a really great example of like, shouldn't this have been torn? How are these people still making money? Like, the wild thing is like, we pay money for like national institute and NIH grants, like National Institutes of Health. We, the taxpayer, fund research, pay researchers because they're doing work. They should get paid for this, right? Then the research gets published in for-profit journals, and then we who funded it have to pay to read the research that we funded. So it's like, hey, my kid is playing in a middle school soccer game. I gotta pay to watch him. I gotta pay a ticket to watch my kids. My kid's the show, man. I'm the show. I produced that, right? So yeah, this is a good question. Like, how would you democratize, or how would you level the playing field on research? It's a multi-billion-dollar market, and you're right. I'm surprised. I think Sci-Hub is it's been called the Napster of research, and it was like invented by like some like, I'm going to say, I think she was a teenage Russian girl, I believe was the story that I heard. And she saw the same thing. This is stupid. And my friend Mike, who's done YouTube videos on, have you ever seen the YouTube video on why your scientific poster is horrible and how to fix it?
No.
I'll share that. We'll do an episode on that. But he's like, this stops progress. He's like, this could stop the progress of the cure for the disease that kills someone that and it could have been there 5 years earlier because of friction.
Right. I just can't understand. Like, we see how, I don't even know. So you said Spotify. I remember Rhapsody. I remember all these subscription services that came out, even Amazon Music. So yeah, I used to go to the store. You probably remember some of the big names. I don't remember, but I'd go to the mall. Let's go back 20 steps. I'd go to the mall. I'd go into the store. I would look through cassettes. I was at a buddy's house this weekend. They were having a graduation party for their middle child. And on the wall was a radio built into the house. And there was a cassette in the cassette player. So I grabbed my 15-year-old son who loves technology, super smart kid. I'm like, hey, Lucas, come over here. Check this out. I push the eject button. It's got that slow, like, psh. I pull it out and I'm like, hey, do you know what this is? And he asked me if it was a VHS tape. That's what he asked me.
Wow.
VHS tape. And he was like, no, that can't be right. That's video. But anyway, so we would go to those stores. Sam Goody. Yes, Bo.
I mean, I don't want
Sam Goody.
I don't want to brag, but I used to work at the Wall.
We would buy them. Anyway, now fast forward, unlimited music, $10 subscription, no commercials, and it gets cheaper and cheaper. Yes, sir.
Well, hold on though. So the progression was if I wanted music, I could listen to it passively on the radio and just wait for whatever idiot radio DJ was going to play next, right? Or
I'd be sitting there waiting to hit the record button on the cassette tape,
because you were trying to hijack that and make your own mixtape, which is essentially what we do now with playlists. But there was an intermediary step or two, and you're mentioning that, which was and my buddy, who was a writer for a paper in Northeast Pennsylvania, did the breakdown for every dollar spent on a CD, how much the artist got versus how much the record company got, and it was criminal. It was absolutely criminal what the artist got in terms of cents on the dollar. But remember, it was pay for it per CD, and you're paying, I don't know, $25 for 10 songs or whatever, 12 songs. 7 of which you were never going to listen to, right? Then singles came out. You could buy just one song, inflated price, but it felt like a better return on investment. But then when we went digital, Apple said songs are 99 cents.
Yeah.
So it was like, well, you could own 1 million songs for $1 million. That is still an insane insane value proposition. If I wanted 1 million, although you're never going to listen to 1 million songs. And now the deal is $10, you can sort of listen to whatever you want. But this is the Blockbuster versus Netflix argument, which is if you went into a Blockbuster and rented 1 million movies, you'd have to pay $10 million. But if you go to Netflix, you could have access to all of them. You're never going to watch all of them.
Right.
But now, and we should do this on Thursday. I just gave a presentation to an organization using this methodology, but it feels like I have this much value, infinite value, when I pay Apple $10 a month to get Apple Music. I'm going to listen to the same 40 or 50 or 100 songs anyway that I would have paid $100 for. But I can, at random, at 2 o'clock in the morning, get that one song without having to feel like they're dipping their hand in my pocket. That's just perceived value. All value is perceived value. Versus an exchange every time, or here's $10 a month, take my $120 a year. I feel like I'm coming out on top anyway. How do we translate that to healthcare? The things that we had on the screen are beginning to do those things, right? If you knew you had access to this app like Kaya Health, if you had that at any time and then could hit a button and either a PT would jump on the screen with you, or if we feel like the app and the PT I'm talking to thinks that this is worth them coming to my house, and I'm saying, yeah, I want this. This is what I want. I want you to come out to my house. Then I feel like I come out ahead and I'm paying a monthly fee. And now we can math that math. Now the economic data where it says not applicable, pricing data not available, we do this enough, we'll have data. So remember, it wasn't cassettes and CDs and Blu-ray to Spotify. There was a thing in the middle. There's always that messy middle before we come to the best solution. Not even saying that we're done doing $10 a month, but I don't know. I can't imagine a better solution than what we have here. I think we're sort of done, like in terms of subscription models are the way to do it. How do we yes and app and PTs to a subscription model? We're in the middle. We're not there yet, but we're on our way.